We appreciate everyone joining us today. Now let me turn it over to you, Tracy.
Thanks so much, Heather. My name is Tracy Rousseau, and I'm with HTA. And today we're going to go over a number of topics related to Medicare and how Medicare-related questions may be influenced at the human resources level. And the reason why this is so timely is because so many of your employees are approaching age 65 and or retirement at this time. As you can see here, over the next 5 years, over 64 million individuals are going to be either approaching age 65 or retirement, which means they're going to have questions. And I don't know if any of you have ever experienced, either for yourself or for an employee, somebody coming to their 65th birthday, but what that means for them is a lot of mail. They are getting inundated with solicitations in their mailbox. And whenever I do presentations in person, which of course we can't do right now because of COVID, but I'm normally, holding my hands apart saying you're getting 1, 2, 3 feet of mail related to Medicare, and you see people in the audience shaking their head vigorously like, yes, oh my goodness, there is so much mail that comes into us. And it says some very scary things like deadlines and penalties and must enroll. And they may be thinking, well, I'm still working at my employer, or my spouse is still working and we have my spouse's group health plan. Why do I have to even entertain any of this stuff? But then it keeps coming, and stacks of it start to pile up on the dining room table, and they start thinking, okay, maybe there's something here. They get nervous, they get anxious. Maybe I need to look into this. And of course, where do they turn with their benefit-related questions? More than likely, they're going to turn to their HR team because that's who they've trusted with their health insurance benefits for all these years. So as an HR professional, you may be starting to find, if you haven't already, you're going to be starting to find that you're going to get more and more Medicare-related questions from your employees. So what I want to do today is I want to walk through the different parts and pieces of Medicare. We're going to talk a little bit about what they cost and what they cover, but most importantly, we are going to be talking about the proper enrollment timing for Medicare. Whether your employee is going to be retiring at 65 or not retiring at 65, we're going to run through a number of different scenarios. So just be mindful that there's a lot of information packed into this next 50 or so minutes. And if it gets overwhelming or confusing, just know that you can come to us afterward, and we're happy to give you any of these answers again, clarify anything. If you're looking for additional training, please reach out, because anything that I go over in summary form today, we do have very detailed trainings on each of these topics that we can make available to you if you want to dive and take a deeper look. But just remember, you don't have to remember all of this stuff. The purpose of today's presentation is to let you know what some of the downfalls or consequences or loopholes may be, so that way you don't find yourself in a position accidentally giving an employee improper advice. So let's just get started and dive right into it, starting off with what is Original Medicare. Medicare is the health insurance that becomes available to your employees as they approach age 65. So at age 65, each employee and or their spouse will become Medicare eligible. And they'll have a decision to make. Do I enroll in Medicare, like the threatening literature says I have to do? Or do I have a valid reason to defer my Medicare and enroll sometime in the future? And that is a voluntary decision as of their own. They can choose to enroll, or they can even choose to enroll in maybe Part A only and not Part B, or they can enroll in both. So we're going to go through all of those different scenarios. But also know that if they're under age 65, they may qualify for Medicare if they're collecting Social Security disability income, or if they have any end-stage renal disease or permanent kidney damage, kidney dialysis, kidney failure, kidney transplant. All of those are reasons to qualify for Medicare at a younger age. And the last thing that I just want to bring to your attention here is Medicare actually has nothing to do with the terminology that we hear so frequently nowadays as normal retirement age. So everybody's normal retirement age used to be age 65. So it didn't make a difference. But now we're finding that more and more people have later normal retirement ages. A common normal retirement age for people approaching retirement now is 66 and 2 months. So often we hear people say, well, my normal retirement age isn't till 66 and 2 months, so I'll just think about Medicare then. This doesn't pertain to me now that I'm only 65. But that's not true. Normal retirement age only is relevant to collecting your full Social Security income benefit. That's when people can collect their full Social Security income. It actually has nothing to do with when they qualify for Medicare. That's always going to be age 65 unless they qualify at under one of the younger assumptions. So when somebody enrolls in Medicare, and again, the benefits part of this presentation is going to be a very high-level overview. If you're looking for more information on the exact benefits of Medicare, please reach out to us after the presentation and we can make additional trainings available to you. But from a high-level perspective, I'm going to spend just a couple minutes on this slide and go over the different parts and pieces of Medicare. Because one of the main confusing factors for many employees that are retiring is I'm used to being on group health insurance, which is one product that takes care of all of my medical needs, medical, prescription, things along those lines. But now that I'm going into Medicare, I hear this whole thing about an alphabet soup. I need A and B and maybe some C and D coverage, and that is in fact true. They're going to need 4 parts and pieces to have comprehensive health insurance in retirement. There's the Medicare A and B, which is through the federal government, known as Original Medicare. Medicare Part A is their inpatient hospital coverage, so they call it hospital insurance. I think of Part A as inpatient, or maybe you think of A for admission into the hospital. If you're admitted, that's going to fall under Part A. And then there's Part B, which is what the government calls medical insurance, but I think of Part B as outpatient insurance. So A is inpatient, B is outpatient. So really everything that you're not admitted into the hospital for. Things like doctors and specialists, labs, x-rays, MRIs, surgeries, chemotherapy, even things that you go to the hospital for but you're not admitted for, like emergency room treatment, or if you're in the hospital under observation, all of that falls under B as outpatient. But as you can see here, there's some deductibles, copays, and co-insurances related to Original Medicare. So it's not full coverage. Some people say, well, don't I just need Medicare A and B only because that's what the government provides to me? And that's not true, because you would have significant out-of-pocket costs if you have A and B only. So when I think of Medicare A and B, I think of great baseline coverage, but we certainly need to stack something on top of it for it to be comprehensive. And what I'm going to draw your attention to is just at the bottom of the left-hand column where it talks about the Part B out-of-pocket expenses, and you'll see that it says Part B coinsurance, 20%. So 20%, if the employee only has to pay 20% of their medical bills, that's probably not too big of a deal. The problem is that there's no cap on your out-of-pocket risk in Medicare. So that's 20% of the $100 bill, but it's also 20% of the $100,000 bill, and that's where the risk lies. In addition to that, doctors, believe it or not, can accept Medicare as your primary insurance, but charge you excess of the Medicare allowable rate. They can charge you over and above the Medicare allowed rate, and of course, Medicare is not going to pay that because it's over their rate, so they can come back and balance bill clients or employees for this overage amount, up to 15% over and above the Medicare allowable rate with no cap on that as well. And that is legal in about 43 out of the 50 states in the United States. Just to give you an example of a couple states where it is not legal for doctors to charge excess, Pennsylvania, New York, Ohio, and a couple states up in New England, excess charging is illegal. But in 43 states, Maryland, Virginia, and basically anything south or west of that, excess charging is legal, and we do see some doctors, and probably even more importantly, some major specialty clinics in the United States charging that excess charge. So it's very important that they also have some form of C and D coverage as well. So Medicare Part C, you may have heard terms like Medicare Supplement, Medicare Advantage, Medigap insurance. All of those terminologies fall under that C umbrella. And just to, again, give you a very high-level overview of how they work, the Medicare Advantage plans, those are the ones that you see advertised on TV most frequently. And many of them are advertised at very low or $0 premiums. What these programs are is they're managed care programs, meaning you, your doctor, and the insurance company are involved in your care needs and care decisions. So the insurance company plays a heavier role in your care needs. Because of that, these are network restricted plans, PPOs and HMOs, and they are low cost on the premium, but they do have copays for all of the medical services. So if you get sick and need a lot of care, you could rack up quite a few dollars in copays. The maximum out of pocket on most Medicare Advantage plans is $6,700 per person per year. Now, the Medicare Supplement is the alternative to that. Medicare Supplement and Medigap, two words for exactly the same type of coverage. So if you hear those words, you can use them interchangeably. These are not managed care plans. So you and your doctor are responsible for your medical decisions. And there's no doctor network restrictions with Medicare Supplement or Medigap plans. So as long as the doctor accepts Medicare, the original federal government A and B of Medicare, which about 98% of doctors nationwide do accept, then they will accept every Medicare Supplement insurance company. It doesn't matter who they are. If the doctor's ever even heard of them, they will accept them. And what these Medicare Supplement plans do is they pay the deductibles, copays, and coinsurances of Medicare. So, for example, Plan F, it pays all of the Medicare deductible, copays, and coinsurances. So everything that you see listed on this left-hand column as being an out-of-pocket expense of Medicare, Plan F pays 100%. So if your employee has Plan F plus Medicare A and B, they have 100% coverage of all Medicare eligible services, meaning they don't pay copays, deductibles, coinsurances, nothing. Very, very comprehensive coverage, no out-of-pocket expense. Now, if they go with Plan G, which happens to be the most popular plan, the only thing it does not cover is the Medicare Part B deductible, which is currently $198. So somebody with Plan G and Medicare would pay the first $198 of their medical expenses, and then after that, they would have 100% coverage for the balance of the calendar year. So what I want you to know is that Medicare insurance itself does not have to be scary. So if you have some employees that are holding off on retirement because they're just scared of what that means for their health care, it's not necessarily a bad thing. You can get very comprehensive coverage in Medicare depending on what products you put in place. And then there's the D part of Medicare, and the D is the drug part of Medicare. So D for drugs. Now, the drug part of Medicare is, in fact, the most confusing part of Medicare for sure. It's the part of Medicare that we really have to tend to and monitor on an annual basis because people's prescription drugs change over time, and these drug plans cover all different medications. So it's not guaranteed that every medication is covered under every drug plan. But the best way to shop for this is Medicare.gov, the federal government Medicare website. Actually provides a nice shopping tool. This is something we typically help our clients with, but it's something that anybody can do, and we can teach you guys how to use it if you were curious as well. But you go online and you plug in your prescriptions, you plug in the pharmacy that you shop at, and it sorts through all the plans that are available in your geographic area and tells you which one's going to be most cost effective based on your specific needs. So these plans get confusing. They have various stages of coverage where you may pay different amounts for your scripts throughout the year. But by going on to Medicare.gov and plugging in that information, you can get a report with not only what's going to be the most appropriate Plan D or the most cost-effective Plan D plan, but also what prescriptions are going to cost in the various stages and what months throughout the year you might be in those stages. So Medicare.gov really helps figure out that Part D platform and what's the most appropriate solution for each person. So again, that's about all I'm going to talk about with the benefits of Medicare. If you seek more information, let us know and we'll get you details on additional trainings for that. What I really want to spend the day focusing on, or the morning, afternoon focusing on, is the when. When do people need to enroll in Medicare? Because as I said, they're getting lots of mail, and it says things like deadlines, penalties, must enroll, but they're thinking, okay, I'm not retiring yet, I have my group benefits. There's lots of factors that go into whether or not they need to enroll in Medicare. Do they have an HSA plan? Do they have, is their employer size above or below 20 employees? Do they have a spouse under age 65 that's relying on them for group health benefits? All of these factors go into play as to what they should do at age 65 with Medicare. So we always recommend that people get advice as they approach their 65th birthday, because you don't want to do anything that's going to get you in trouble later. And although family and friends mean well, and I'm sure they have a lot of great advice to offer based on their own personal experience, but the thing is, everybody's situation is not the same. So parents, siblings, neighbors, even coworkers that might be on the same group health plan as you may not be in the same Medicare situation. So it does make sense to get advice from a professional that understands the Medicare rules in and out. Because if you do something, or if you, more importantly, don't do something, like you don't enroll in Medicare when you're supposed to, there are some significant consequences in the form of penalties or deadlines, that you may miss your deadline and be locked out of the insurance for up to a year, or sometimes even longer, depending on the situation. Or there could be gaps in coverage where you have your coverage, nothing's changed, but due to some kind of either life event or an age change, your current coverage may change to a secondary payer. And if you don't have Medicare in that primary payer position, you may not have full coverage any longer. So these are all major consequences that could happen to somebody if they don't enroll in Medicare when they're supposed to. So we're going to go through a couple of different Medicare scenarios as to who's supposed to enroll when, but what I'd like to first start out with is, how does the Medicare enrollment work? Is it automatic at age 65? Because a lot of people think, okay, I'm going to turn 65, I'm just going to get my Medicare stuff in the mail. And that's not necessarily true. It used to be true. Medicare used to automatically enroll everybody at age 65 unless you contacted them to not enroll. But they don't do that anymore because so many people are working past 65 and staying on their group health plans. So if somebody is collecting Social Security income prior to their 65th birthday, Medicare enrollment is still automatic for them. So this probably isn't going to be your active at work employees, because they're probably not collecting because they're still working. But it may be their stay-at-home spouses. Perhaps their stay-at-home spouse started collecting at age 62. Well, in that event, what would happen is when that person turned 65, they would get their Medicare card in the mail, and it would have them enrolled in both A and B. And the premiums that are involved, and we're going to talk more about the cost of Medicare. I have that in the wrap-up when we go through the different parts and pieces of Medicare and just wrap everything up at the end of this presentation. I'll talk more about the costs of Medicare. But if they want to return the Part B, the part that they pay for, they can simply return the card at that time and ask to disenroll in the Part B. They would keep Medicare Part A because Medicare Part A is free, but they could always return the Part B if they're not ready for it and they were automatically enrolled at 65. So some of your stay-at-home spouses of your active at work employees that want to remain on your group health plan, they may fall into this situation and may want to return their Part B. But for most people who are still working and not yet collecting Social Security income prior to their 65th birthday, they will not be automatically enrolled. In order to enroll in Medicare, you have to physically take action, and that would be going online and enrolling yourself. So if you decide that you don't need Medicare at 65, the way you defer is to simply not enroll. Do nothing, and you will have deferred by default. So they can choose, do I want to go in line and enroll in the free Medicare Part A only? Or do I want to not go online at all and not enroll in anything? That becomes their choice. But if they want Medicare at 65 and they're not collecting Social Security income, they would physically have to take action to enroll. So you may have noticed a couple of slides ago when I was talking about the consequences, the penalties, and the deadlines. In parentheses, it said, if you don't have credible coverage. So what I want to first start off by explaining is, what is credible coverage? What is a credible reason to defer your Medicare? Credible coverage is defined as group health insurance based on current active employment. So if somebody is currently employed at your company and on your group health insurance plan, they have credible coverage. Now, the group health insurance has to be coming from the employer that they are currently employed at. They can't be employed at your company and have a group retiree health plan from a previous employer, like, say, a federal government job or something like that. Because even though that's group coverage, it's not based on the current active employment where they are now. Okay, so group health insurance based on current active employment, anybody who's employed at your company who is on your group health plan has credible coverage. But the current active employment is based on the primary insured. So if there's an employee active at your company, they're on your group health insurance plan, we know they have credible coverage. But if their dependent spouse is also covered under your group health insurance plan, then they too have credible coverage. The dependent spouse does not have to be employed themselves as long as they're receiving group benefits where the primary insured is currently actively employed. So I hope that made sense the way I explained it, but the bottom line is, for most of the people that are on the line today, if your employees are still working and they and or their spouse is covered under your group health plan as an active employee, then they will be able to defer Medicare at age 65 with no penalty. So what's not considered credible coverage? Things like ACA or Obamacare. So maybe you've had some individuals that retired early. Maybe they retired at 60 or 62 or were laid off and they decided to go into the marketplace to get their plan. That's not credible for Medicare purposes. They would need Medicare at age 65. Also, group health plans not based on current active employment. So things like COBRA benefits, retiree, severance benefits. So what I want you to remember from this whole presentation today is that those three things I just mentioned, COBRA, retiree, and severance, are big red flags when it comes to Medicare. So if you have any employee that is thinking about leaving for whatever reason, whether they're leaving, they're retiring, or they're being laid off, and they're considering COBRA, retiree, or you're considering giving them severance benefits, I want you to remember, red flag for Medicare, and this needs to be looked at a little bit more in detail if they are approaching age 65 or over age 65 when they're being offered this benefit. We're going to go through that in a little bit more detail in just a moment, but that's the one main thing I always want people to remember as a red flag. Okay, so let's talk about the most common scenario. And what you're going to see on the screen actually throughout this presentation, these are some tools that we use specifically with our clients. These are all custom created web pages and handouts that I personally have created for my company to use with clients. If you want copies of any of this stuff, please don't hesitate to ask. I'm happy to provide it to you. But what you're going to see here is a summary of something that we would provide a client with after we've had a consultation call and letting them know what they can and can't do with Medicare. But this right here on the screen is the most common scenario that we run into. Up in the top, you'll see, and this is just a screenshot of a web page. It may be a little bit print and a little bit hard to read for you, but it's talking about somebody who the primary insured, the main employee, is going to remain actively at work. They're covered under the group health plan, and the employer providing the health insurance has more than 20 employees. So if I'm going to keep working, my spouse and I are going to stay on my group health plan, and my employer has more than 20 employees, do I need to enroll in Medicare when I turn 65? So a couple things. Will I receive a penalty? No, I'm not going to receive a penalty because I have credible coverage. And if you were to click on this box, now this is a static screen here, so I can't show you what it looks like, but if you click on this box, it pulls up the Medicare rules and regulations that actually support this answer here. So you get the short form answer, but then you can open this up and see all the rules and regulations and click on links, and it'll push you right through to Social Security's and Medicare's webpage that shows you exactly where those rules and regulations are listed. That way you know you're getting an accurate answer. What is my deadline to enroll? So for individuals that are going to continue working past 65, they'll actually have 8 months from the time that they stop working or from the time that they come off their group health benefits to enroll in Medicare, whatever happens first. So if they stop working, even if they're going to remain on the group benefits via severance or COBRA, they'll have 8 months from the time they stop working to get into Medicare. And they don't even need Medicare for full coverage because because the group health plan will remain the primary insurance as long as the employee remains actively employed. So for somebody who is going to continue working on the group health plan and more than 20 employees, they don't need Medicare A or B in any way, shape, or form, but they do always have the voluntary right to get that. Now, there may be more of a question of, should I take A because it's free? And I'm going to address that in just a couple slides. So for somebody, just to summarize, somebody with credible coverage, they will not receive a penalty if they don't enroll in Medicare at 65. They're going to have 8 months from the time that their group coverage or their employment ends to get enrolled. And this is a screenshot of the form that's going to be necessary to enroll in Medicare. This is called a employment verification form. We do provide a link directly to this form, so if you don't have it in your document library in your company, we're happy to send you a link to it so you can keep it there. But typically, any individual that we were to talk to, we would provide this form and give them instruction on how to take it back to their employer. The form asks for a couple pieces of information. Super simple to fill out. I'm guessing that most of you on the line are very familiar with this form. Asks for the employer information, but the two important questions: the date the applicant's coverage began and ended, showing that they've had group coverage since they've been 65, and the date the employee started and ended work, showing that the employee was actively employed and that the employee and or spouse has been on that group coverage since age 65. And this is the ticket in the door to Medicare. So you're going to bring this down to the Social Security office, hand it in, and they're going to say, great, when do you want your Medicare to start? As long as it's within 8 months of the employment or the coverage ending. Now, it does say take it down to your local Social Security office today in the COVID environment. That's not really what we're doing. They've provided other resources. Most people now are applying online, and they've provided an upload link where you can upload this form online and fill out a DocuSign form to apply. You can do it by fax, you can do it by mail. So we're not really advising to go to the Social Security office anymore, but hopefully sometime in the future that will open back up. And then, as I mentioned, if the company has more than 20 employees, as long as you remain actively employed, your group coverage is primary to Medicare as long as you have it. So you really don't need Medicare if you plan to stay on the group coverage. The question would really be, do I want group coverage or Medicare? Not do I want both. And then if it's under 20 employees in the company, Medicare may be primary insurance at that time. And if Medicare becomes the primary insurance, you may need Medicare even if you intend to stay on your group health plan. So if any folks on the line have companies of less than 20 employees, there may be some significant considerations you need to make if any of them approach age 65. So just bear in mind that would be another red flag that I would bring to your attention for groups of under 20 employees and the Medicare treatment of that group health plan. So for people without credible coverage, things like ACA, Obamacare, but the ones that you guys should run into more frequently may be COBRA, retiree benefits perhaps, or severance coverage. So these plans are not credible coverage. Therefore, if you don't enroll in Medicare and you find yourself on one of these plans at 65 or after 65, you will start to accrue a penalty if you don't enroll. And you'll have 7 months surrounding your 65th birthday. If you're in this situation and you're approaching age 65, you have a 7-month window of opportunity to get enrolled in Medicare. That's 3 months before your birthday, the month of your birthday, and 3 months following your birthday to get enrolled in Medicare before you hit that deadline, and then you're locked out to only enroll once a year thereafter. And the way that enrollment is handled, there's no additional forms needed if you're enrolling at 65. You just enroll online. The form's super easy. It's through the Social Security website. But one red flag that I just want to bring to your attention, again, this is all about identifying things that you may not know exist, little loopholes and bumps in the road with Medicare. If you have an employee that is thinking about retiring right around their 65th birthday. So let me give you an example. We have a client who's an accountant, and their birthday is in March. They turn 65 in March, and they say, well, I'm going to retire, but I want to finish out my tax season. So I'm going to work through the month of April, and I'm going to retire at the end of April for a May 1st retirement date. So my group health benefits are going to end on April 30th. I'm going to need my Medicare to start 5/1, May 1st. And they may be thinking, okay, well, Tracy just said I have 3 months after my 65th birthday to enroll in Medicare. So that's certainly within my time frame to get enrolled. I'm not going to get myself in any trouble. So they think, okay, best logical thinking, and this would totally be my thinking, if I want my effective date of Medicare to be 5/1, I should go online in April and enroll, because that would hopefully give me a 5/1 effective date, because your effective date is defaulted based on what month you go online in that 7-month period. You can't go online and say, this is the effective date I want. It's going to default based on when you go online. So most people would think, okay, if I want it to default to 5/1, I'll go online in April and I'll get a 5/1 effective date. But that's not going to be the case, because Medicare has goofy rules here. If you go online in your birthday month, so this gentleman's birthday was in March. If he went online to enroll in March, his effective date would be April 1. But if he goes online in April to enroll, there's going to be a 2-month delay, because it's the month following his birthday. There's going to be a 2-month delay before his Medicare starts. So it won't be May 1, it'll be June 1. And if he goes online in May, it's not going to be June 1, it's going to be July 1. So there could be a delay in when it starts, and you don't need to remember the rules. And to be perfectly honest, every time I do this, I still have to count it on my fingers because it's so goofy the way it works. But just know that the effective dates are kind of goofy how they're set up, and they're defaulted by the computer system, so you don't get to choose what date you want. So it's really important that you go online in the month that is appropriate for the effective date you want. And for this gentleman, this example that I just gave, he actually couldn't get a 5/1 effective date because of the month his birthday fell in. It just simply was not an option for him. So he had to make a decision. Do I want my Medicare to start 4/1 and have an overlap, or do I want it to start 6/1 and go a month without coverage or a month with COBRA? So he had a decision to make, but that's okay, because we were planning far enough in advance that he could make that decision. He wasn't surprised in the month that it was made. And just to talk about primary coverage, if somebody's on an individual plan, Medicare is definitely going to be primary when they turn 65 and necessary for coverage. If they're on retiree, COBRA, or severance, Medicare may be primary. That's where I normally say, let's go back to the account administrator and confirm the primary status of the coverage for those age 65. So you may need Medicare to have full coverage in addition to the deadlines and penalties. So there are a couple questions in the chat box, but in the interest of time, I'm going to continue. Keep putting your questions in there. I do welcome all the questions, but if it's okay, I'm going to scan through them at the very end of the presentation just so we can stay on track. But keep typing them in as you think of them so we can go back and address them later, and that way you don't forget. One thing that I want to mention with COBRA, retiree, and severance coverage, because these types of coverages are considered probably secondary to Medicare, and also because there's deadlines and penalties, specifically with severance coverage. If you're thinking about laying off an employee and offering severance health insurance benefits, Or perhaps you have an executive that is retiring and you wanted to cover their benefits for a certain period of time, 3 months, 6 months, a year after they leave. Since Medicare may be required to be primary insurance anyway, we could probably structure something that's a little bit more beneficial for both the employer and the employee. Because if you offer, it's very nice to say, hey, we're going to cover your benefits for the next 12 months. But the problem with that, or what we've seen the problem with that to be, is sometimes that employees then let their guard down and say, oh, my employer's taking care of my benefits for the next 12 months after I stop working. I'll think about Medicare when they're done taking care of my benefits for me. And then they come 12 months later and say, now I want to enroll in Medicare. And Medicare says, no, you only had 8 months to do that. Sorry, you're locked out. You can't get in until next year. So one thing about offering benefits for 12 months or something along those lines is people get their guards down and they don't realize that they still need to address the Medicare situation. The other thing is, if Medicare is required to be primary now that the person is no longer actively employed, many group health plans will say, we've moved to the secondary payer position. They may find themselves, you are, as the employer, paying the full amount of premium for these group benefits for them, but they're only getting about 20% coverage out of them because Medicare is required to be primary. So the employee is paying for Medicare just to have full coverage, and you're paying the full cost for the group benefits for them, even though they're not realizing the full benefit out of the plan. So sometimes it can be structured a little bit better for everybody involved if perhaps you say, okay, instead of providing you benefits for 12 months, we'll give you enough money to get your Medicare for the next 12 months. It'll probably save the employer about 50% or more on the premium dollars. And for the retiring employee or the laid off employee, it's saving them money too because they otherwise would have had to pay for Medicare on their own. So there could be different ways to structure severance benefits to be more beneficial on both the employer level and the employee level, if that makes any sense. And then let's talk about COBRA in a little bit more detail. And severance and retiree benefits are similar to this. This is just an example of our COBRA recommendation webpage. And you can see here, if somebody's thinking about going on COBRA, we're going to provide them with a list of questions that they need to go back and verify before they make any decisions of what to do. For example, are my COBRA benefits going to remain primary even though I'm over 65? Will my premium change? Things along those lines. One of the questions is, can my spouse maintain benefits even if I go on to Medicare? And the answer to that is yes. So a lot of the times employees think, well, if I'm coming off the group health plan and my spouse is under 65 and not yet eligible for Medicare, I better elect COBRA so they can elect COBRA as my dependent. But that's not actually the case. If the employee chooses to go into Medicare because they're over 65, the spouse can still take COBRA. And in fact, the spouse may actually have additional COBRA rights where they can extend their COBRA up to 36 months if the primary insured's reason for not going on to Medicare was because they were not going on to COBRA was because they were Medicare eligible. So when somebody is thinking about going on COBRA and over age 65, we normally find that the main motivation to that is because they have an underage 65-year-old spouse and they're not aware of that their dependent spouse can still take the COBRA even if they don't. And they're also not aware that if they take COBRA, they may get themselves in trouble with Medicare later, because if they wait out the 18 months on COBRA and then they go try to apply for Medicare after that, Medicare is going to say two things. Number one, you missed your 8-month deadline, you're locked out for a period of time. And number two, you've gone more than 12 months without having credible coverage, you have a penalty now, and that penalty is stuck on your Medicare for the rest of your life. So we see a lot of people making mistakes with COBRA because they're not familiar with how the COBRA and Medicare rules work. And on this webpage, we even have a link here that says more about Medicare and COBRA. You click on that and we have even more details about that as well. So we talked about a lot of things so far. We probably have discovered that most of our employees do not need to enroll in Medicare at age 65 as long as they're going to keep working, and neither do their dependent spouses. But the question comes up is, what about the Part A? The Part A is free, and my friend or my neighbor or my coworker told me I have to take Part A, even though I can defer my Part B, the part that I pay for. And actually, believe it or not, that's not true. Think of it this way. Medicare Part A is free for most people. The only thing you have to do to get Medicare Part A for free is pay Medicare taxes. And most people have done that, or at least they have a spouse that has. As long as you get Medicare Part A for free, you can enroll at 65 if you want to, or anytime thereafter with no penalty or deadline. So think of it this way. What's a 20% penalty of $0? Still $0. So no penalty for enrolling in Part A late. But hey, Part A is free. It's free benefits from the government. Why wouldn't I take it when I first become eligible? Even if I'm going to stay on my group health plan, why wouldn't I have this as a backup? Well, that's a good point. Why not? And we do generally recommend people enroll in Medicare Part A at age 65. Number one, why not? It's free and it gives you a little bit of extra benefits, maybe as a backup to your group health plan if you get hospitalized. And the other thing that it does, is it registers you with Medicare. It assigns you a Medicare number when you enroll in Part A. So if age 68 you decide to retire and want to enroll in Part B at that time, it'll make the Part B enrollment process that much easier because you already have a Medicare number assigned to you. So we do typically recommend that people enroll in Part A. However, if somebody has a health savings account and they're making deposits into that health savings account, or perhaps you're making deposits into that health savings account as their employer, an employer match or an employer-funded HSA. Those individuals would not enroll or should not enroll in Medicare Part A. Even though it's free, it will disqualify them from making deposits into their health savings account. So once you're enrolled in Medicare Part A, you become ineligible to make deposits, and unfortunately, nobody tells them that until they get audited on their tax return and they find themselves in trouble with penalties and interest and tax payments that they have to make on those deposited funds that they didn't even know that they weren't eligible to deposit for. So typically somebody who wants to remain in their group health plan and have an HSA, a health savings account, and make deposits in that, we would recommend that they defer their Medicare, both Part A and Part B at 65. They can certainly enroll in it later. The good news is, and I love HSA plans. I'm actually on an HSA plan myself. I am a huge proponent to max funding that if you can afford to do so, because not only can you use that money for medical expenses, as we all know, but you can use that money for Medicare premiums as well. So your HSA savings, if you can acquire some savings in your health savings account, it is tax-free retirement health care savings for later. It is a way to pay for your Medicare benefits with a tax-free status in retirement. So I think HSA plans are a great way, another retirement planning tool to get tax-free health insurance once you're in retirement. So anybody who's on an HSA plan, I would not discourage them from being on it just because they're of Medicare age, but they need to understand the Medicare rules so they don't make any mistakes. And one more thing to mention with this is, let's say somebody did not take Medicare Part A at 65 because they knew they wanted to keep contributing into their HSA, but now they're 68 and they want to retire. And so they're going to come off their plan and they're going to enroll in Medicare. Well, what happens when you enroll in Medicare? You can choose a current effective date. Let's say, for example, and the example on the screen here is somebody who is retiring on August 1st. So if somebody was to retire on August 1st, they would take their employment form to the Social Security office or upload it or fax it in or whatever it may be. And they're going to say, I want to enroll in Medicare for 8-1. And Social Security is going to say, great, we'll put you in that Part B, that part you pay for 8-1. But your Part A is going to be backdated 6 months. By default, the Medicare system always backdates the Part A 6 months, no sooner than your 65th birthday. But if you're over 65, they're always going to backdate it 6 months. So in this example, that gentleman got a February 1st start date on his Part A, and got an August 1st start date on his Part B. And so what we have to do in that situation is we cannot contribute more than the prorated amount of the maximum HSA for that calendar year. So since his Medicare Part A became effective 2/1, he was only, quote unquote, not in Medicare for 1 month, the month of January that year. And so he is only eligible to deposit 1/12 of the HSA maximum for the year. So it's not that he has to stop depositing as of February. It's just he cannot deposit more than the prorated maximum for the year. So again, this is another example of rules that you don't need to remember how they work. You just need to know that they exist. And another, if we were picking out the red flags throughout this presentation, a red flag would be somebody with an HSA who's approaching 65 or Medicare, looking to seek some advice on to the proper timing and deposit amounts before they make any mistakes. So the last thing that I want to touch on here is who should enroll in Medicare. Now, we know that most people don't need to enroll in Medicare if they're going to keep working, but perhaps it's a good idea for some people to enroll in Medicare. And you as the employer, as long as you have more than 20 employees in your company, I'm sure you know that you cannot force them off the group health plan. You cannot incentivize them to come off the group health plan. But if they make their own voluntary decision that Medicare is better for them, they can voluntarily waive off the group health plan. So let's look at a break even for this. So if your company has more than 20 employees, if somebody, now look at the premium that's being payroll deducted out of their paycheck, plus their out-of-pocket costs, deductibles, copays, coinsurances. If their cost, premium and medical expenses, is more than $3,600 a year on average, then Medicare probably will be more cost effective for them. Now, I'm not saying just jump off. I'm saying let's take a closer look and look at it side by side and talk more in detail about your medical needs and everything else. But that's a good break even or a good rule of thumb. If an employee is paying more than $3,600 out of pocket, premium plus medical expenses, then Medicare might be more cost effective. If they're paying less than that, then their group health plan is definitely more cost effective than Medicare, and they should stay on it. And just bear in mind that if your contribution rate for the dependent spouses is lower than for the employee themselves, then many dependent spouses, we find about 60% of dependent spouses choose Medicare as being more cost effective than the group health plan, just because the employer contribution is not as significant for them as the working spouse. So this can be an independent decision, and we do find that many dependent spouses voluntarily, once they're educated, voluntarily choose to waive off. So here's an example of a cost analysis that I recently did for a client. We look at it on 3 different levels. We look at it as the premiums first. So in this example, the group health plan provided lower premiums for both the employees and the spouses. So from a premium perspective in this example, the group health plan was better. But on the major medical out-of-pocket, the group health plan had a maximum out-of-pocket of $5,000, whereas Medicare plus a supplement had a maximum out-of-pocket of $198. So the maximum out-of-pocket was definitely better with Medicare than it was with the group health plan. And then the prescription drugs, that's always a variable that we have to look at before we move anybody, because that does have a potential to be expensive in Medicare. So we definitely want to do a more thorough comparison of their specific meds, group health plan versus Medicare. But in this analysis, what you can see here is if somebody's healthy and they're just paying their premiums and doesn't really have high out-of-pocket costs, then the group health plan makes more sense. But if somebody starts having high out-of-pocket costs and is starting to come to their out-of-pocket maximum, then Medicare might make more sense. And so the break even in this example is, okay, somebody on the plan 1, if they have more than $2,000 if they're hitting at least $2,000 in their maximum out-of-pocket, then Medicare would be a consideration for them. If they're less than that, then stay on the group plan. And on the HSA, the break even for them was $2,500 in out-of-pocket expenses. So the advice there would be, hey, while you're healthy, keep your group health plan. But if something happens to your health and you're going to start seeing more medical expenses coming up, we want to revisit Medicare because it may be more beneficial for you at that time. So for you as an employer, we know that group health plans rates go up based on claims experience. And statistically, 65 and over provide a lot higher claims experience than many of our younger employees. And so the good news for you as an employer is if somebody is having significant out-of-pocket costs on their medical expenses, Medicare, if they understand how Medicare works and get a little Medicare education, they may find that Medicare is more beneficial and voluntarily choose to come off your group health plan. Therefore, it's better for them. It's a win-win. Better for them because they're getting better coverage at a lower, amount of out-of-pocket. And it's better for you because that's not hitting your claims experience as an employer. So there's a couple times when someone can come off the group health plan. They can come off the group health plan when they're turning 65 as a life event. They can come off the group health plan each year at the renewal or open enrollment. They can opt out. But many groups, and you would want to check with your administrator, many groups consider quote unquote enrollment in Medicare as a life event. So if somebody just arbitrarily chose at 68 that they think Medicare is better and they want to enroll, most group health plans will honor that as a life event. So if somebody gets diagnosed with cancer and says, hey, I'm going to hit my maximum out of pocket, they can choose to go into Medicare at that time and have a life event to come off of your group health plan and have their medical expenses covered better for them moving forward. Okay, so let me tie all of this together and then we'll get to the questions. So if we were looking at somebody to comprehensively be in Medicare and what their costs would be, we have the Medicare Part A, so kind of going back to what we talked about in the very beginning. Medicare Part A, through the federal government, inpatient coverage is free, $0 premium. Medicare Part B is an income-based premium, but for many people, it's going to be $144.60 per month. These are all 2020 figures, by the way. These figures have the ability to change each year, and rumor is that it's going to be somewhere in the ballpark of $153 for the base Medicare Part B premium next year, but nothing has been confirmed formally by the government on that yet. And then they're going to have some form of Part C, whether that's Medicare Advantage or Medicare Supplement. In this example on the screen, this is a Plan G Medicare Supplement, the one that has the $198 deductible and then 100% coverage thereafter. An estimated premium for that would be somewhere in the ballpark of $100 to $135 a month for somebody who's in their mid to late 60s. I have estimated premium here. Of course, if I was talking to somebody specifically, I would put in the exact carrier they've chosen with their exact premium. And the Part D plan, again, I have an estimated premium in here of $25. That's pretty typical. We find that probably about 90% of our clients are on a plan that costs less than $40 a month, with probably at least 50% of them on a plan that's less than $25 a month. Next year in 2021, the lowest cost prescription drug plan is going to be like $7.50 a month. So they're not super expensive plans. So for somebody who's in the base income bracket, they're going to pay somewhere in the ballpark of $275 to $325 per month per person to be in Medicare with a comprehensive Medicare supplement program. But we're going to add some money for each income bracket they go up. So here are the income brackets. You can see the base income bracket is for individuals earning less than $87,000 a year, or for households earning less than $174,000 a year. And you can see how those income brackets go up and how the corresponding Medicare Part B premium goes up. And then on the drug plan, in addition to the insurance company premium, there would be what they call, so affectionately, I always know people that have high income because they'll call and they'll say, I hate IRMA. And I go, oh, you must make a lot of money, because IRMA stands for Income Rated Monthly Adjusted Amount. Basically, it's an income surcharge on your Medicare prescription drug plan. So in addition to the insurance company premium, the federal government would charge you a monthly income surcharge on your plan. So these are all monthly per person numbers that you see on the screen here for the different income brackets. They are based on modified adjusted gross income, the best estimate that people can find on their tax return, because modified adjusted gross is not listed on your tax return. But if you look at your adjusted gross, bottom of the first page, that's going to give you a good estimate of the number that the government looks at when determining your Medicare premiums. And believe it or not, they look at it from your income 2 years ago. So for those individuals that earned a lot of money when they were working, but are now retiring and their income's going to go down, there's a couple things that they can do to bring their Medicare premiums down. Eventually, Medicare will figure it out, but they're 2 years behind everything, so they won't figure it out for 2 years that your income's gone down. So there's an appeal form that can be filed, and that's something that we can make available to you or directly to the employee if they need to file an appeal. Anybody who's of a higher income, if I were to talk to them, I would definitely talk through the appeal process and give them the form to do that if their income was if we're anticipating their income to go down in retirement. So it's not getting locked in here based on what it was 2 years before you retired, is what I'm trying to say. So just to bring this example full circle, if we have somebody in the highest income bracket, we can see that their Part B premium has changed. Now they have a surcharge on their D, their IRMA surcharge. So somebody in the highest income bracket is going to pay about $700 to $750 per month per person to be in Medicare. So last thing, not going to spend any time on this, but I did want to let you know that Medicare does not cover long-term care, routine dental or vision, hearing aids, and some other services as well, which I think these other ones are pretty self-explanatory. So if somebody's in need of this type of care, there are other insurances that pay for it, but it's not part of the base Medicare program. Okay, so I'm just going to summarize this up, and then I'm going to read through the questions and go over them. Just a quick commercial. Thank you so much for bearing with me for the 50-plus minutes to get your continuing education. Just so you know, if you found any of this overwhelming today, we are here to help and support you, and we would love to hear from you if you need anything. We provide free employee educational meetings and webinars. We can do a cost-benefit analysis similar to what I was talking about in the presentation to let you know how your group health plan stacks up against Medicare and which employees may find Medicare more attractive. And we provide free and unlimited telephone and email support to our HR teams as well as their employees who have Medicare questions. There's never any charge for our services, so please don't hesitate to reach out if you have any questions. We will not be charging you to answer those for you. And here's our contact information. I'm going to leave this up on the screen here as I filter through some of these questions. So there are quite a few questions in here, and I want you to know that we will and answer every single one of these questions. If we don't get to it on the webinar today, we can email you a response, but I am going to pick out at least a handful of them. If you don't want to stay on the line to continue to listen to the questions, you can feel free to disconnect. We have gotten through the CE portion of this program, but there are a lot of really great questions in here. If you have a couple more minutes, I would encourage you to stay on the line. So first question, is there a very high cost for Plan F? Plan F, and we're talking about Medicare supplements now. So Plan G for somebody in their mid to late 60s is going to range between about $100 and $140 a month in most areas of the United States versus that was for Plan G. I'm sorry, I don't know what I said. So Plan G is $100 to $140 a month. Plan F is going to be more like $140 to $180 a month. So what we find is that Plan F typically costs someone about $250 to $500 more per year in premium than Plan G. But the only additional benefit that Plan F covers is that $198 deductible. So although the cost isn't that high, you're going to pay $250 to $500 more for a $200 in round number benefit. So at the end of the day, Plan G is probably more cost effective for many people because you're getting more than enough premium savings on it to cover that deductible that you're going to have to pay. Okay, next question. If the participant is not taking any prescriptions at 65, do they need Part D? So technically speaking, you are not required to take Part D. However, the government gives you a nice incentive to get Part D in the form of giving you a penalty if you don't take Part D. So for individuals that are not taking prescription drugs at age 65, my recommendation would be to get a very inexpensive Part D plan. Like I said, next year, the lowest cost Part D plan is going to be about $7.50 per month. Number one, that's going to provide you with coverage. So should you need prescriptions, you'll have coverage. Number two, it's going to avoid any penalty accruing. So you're not going to accrue a penalty that's going to be added to your prescription drug plan later if you enroll late. And number three, if you don't take a prescription drug plan when you first, now, if I'm sorry, I guess I should have pre-qualified this as saying if you have credible coverage, you don't need a Part D plan until your credible coverage or your employment is getting ready to end. So I'm assuming here that this question is for people that are otherwise enrolling into Medicare and don't have credible coverage. So if you don't enroll in a Part D plan and you don't have any other credible prescription drug coverage, you will be locked out of a Part D plan except for once a year thereafter. So you definitely, we would recommend that you get one, get an inexpensive one so you have it in place and you're not locked out and you're not accruing a penalty. And every year during the annual enrollment period, we can reshop that for you. So if you start taking prescriptions on a regular basis, we can consider that in a future plan selection. Okay, moving on. Can there be an issue with moving from Medicare Advantage to Original Medicare? Issues with coverage for pre-existing conditions or even obtaining coverage? So that is another great question. We had talked about that Part C umbrella being either Medicare Advantage or Medicare Supplement. Medicare Advantage having, in many cases, a $0 premium versus, what did we say with a Med Sup, maybe about $135 for a comprehensive Plan G. So what some people say is, okay, I'm healthy. Why don't I take the $0 premium one, and then I'll move over to the Medicare Supplement later when I start having medical expenses. So number one, every year you can move from Medicare Advantage back to Original Medicare during the annual enrollment time for January 1, or there's even a Medicare Advantage disenrollment period in the beginning of the year. So it's not going to be an issue getting you back to Original Medicare. But Original Medicare, remember, only pays about 80% of your bills in round numbers. So that Medicare Supplement that you need to pick up the difference, Medicare Supplements have a one-time open enrollment period for you to get any supplement you want with no medical questions. So you can get in the door no matter how unhealthy you are. After your first 6 months in Medicare, if you want to get a Medicare Supplement plan in probably about 46 states in the United States, you will be required to answer medical questions to determine if you're eligible. So although you can get back into Original Medicare, it may not be as easy to get that supplemental coverage later if you've acquired some health conditions. Okay, so if I'm covered under my husband's medical and he is retired and I am 65, I have to enroll in, the question here says Medicaid. I think what this person meant to put is Medicare. So yes, if you are covered under your husband's medical plan, so I assume he has a group health insurance plan, but he is retired, so his group health insurance plan is not based on his active employment. Maybe you're offered retiree benefits from his employer. Once you turn 65, you should enroll in Medicare to combine with that. Number one, because if you don't and you try to enroll later, you're going to have a penalty. Number two, because if you don't and you try to enroll later, there's only one time of year you can enroll moving forward. And number three, and this would be one that we would have to check on his group health plan, his group health plan may not be the primary payer once you turn 65. You may need Medicare to sit in front of it now that you're 65 to have full benefits, but that's on a case-by-case basis. So that's something that we would want to go back and confirm with the employer. Okay, moving on. I thought I was required that everyone at age 65 enroll in Part A, whether or not they continue to be employed at an employer and have credible coverage. So that is the number one misconception that we hear. We have people call us all the time and say, I know I don't need my Part B, but I was told I must enroll in Part A. Or the new language that I'm hearing people say, and I think this might be some kind of marketing ploy that somebody's doing, saying, I was told I just have to register. I don't need to enroll, I just need to register for Part A. So no, that is a misconception. As long as you have paid Medicare taxes or your spouse has paid Medicare taxes, meaning you qualify for free Part A, you do not need to enroll in Part A at age 65. You will not get in any trouble. And remember that web page that I showed you earlier in the presentation that had all of those answers. Let's see. I don't know if you guys can still see my screen. Here it is. Do I need to have Medicare for full coverage? If you click on this plus sign on that web page, it'll pull up and it'll say specifically Part A, no penalty, or I'm sorry, will I have a penalty if I don't enroll? You click on that plus sign, Part A, no penalty, and there's going to be a link there that you'll click on so you can read that language directly from Medicare's website. That is the number one misconception that I see in Medicare. Although unless you have an HSA plan, there really would be no reason not to enroll in Part A unless you just simply don't feel like it, which is fine too. A lot of people say, hey, if I'm going to deal with this, I'll just deal with it all later. I don't even feel like enrolling in Part A until I need it all. So good question, very common misconception, the number one question we get. All right, let's see what else we have here. Is there a penalty if an employee is covered by insurance through the company but also signs up for Medicare A because they thought they had to? So that was great that they came back to back from each other. No, there is no penalty for enrolling in Part A or even Part B for that matter. They can enroll in both A and B and keep the group insurance if they want. Now you would have to pay for Part B. The group insurance, if there's more than 20 employees in the company, the group insurance is going to sit primary. So the A and B benefits won't even come into play except as secondary to group insurance. So they probably won't get a whole lot of benefit out of it. But there's no penalty for signing up. The only reason somebody would definitely not want to sign up for the free Part A would be if they had a health savings account and were making deposits, because then you'll get penalties on the deposits that you're making because you're not eligible to make them any longer. But if you don't have an HSA account and you enroll in the free Part A or even Part B for that matter, no penalty at all, just the Part B premiums that you would have to pay for. Okay. I'm just going to keep going through here. If you guys are enjoying listening, please stay on the line. If you'd like to disconnect, you're certainly welcome to do so. What about Part D, the RX part of this? Does the employee have to enroll in Part D? So Part D follows the same general guidelines as regular Medicare. As long as you have credible coverage, you don't need to enroll in Part D either. Now, the credible coverage definition for Part D is a little bit different than it is for Medicare A and B. Credible coverage for Part D means that you have a drug plan that is as good as or better than Medicare's prescription drug plan. So very loosely speaking, if you have prescription drug coverage through any resource, whether that be your employer, an individual plan, the VA, whatever it may be, more than likely that is a credible drug plan and you are not required to enroll in Medicare Part D until you come off that credible drug coverage. It has nothing to do with active employment. It's just that your drug benefits are as good as or better than Medicare. So simple answer to your question is as long as they have a drug plan, they are not required to enroll in Part D until that drug plan ceases to exist. There are some drug plans out there that are not credible. The only ones that I have seen are the highest of deductible HSA plans. Like sometimes I see a $6,000 HSA individual deductible that would not be considered credible. It would be credible for Medicare A and B because they're actively employed and on group coverage, but it wouldn't be credible for drug benefits because their drug benefits are not as good as Medicare's because there's a $6,000 deductible. If that's the case, your group administrator should have told you that that drug coverage is not credible for Part D. And as an employer, you are required to send out a Part D credible coverage notification each year. We do have a sample one, so if you're looking for that credible coverage Part D letter that you can share with your employees each year, we're happy to email that to you. Please just let us know, either put a comment in these questions or send an email afterward and we can get you that letter. But most plans are considered credible for Part D. If an employee leaves an employment when under age 65 and the spouse is over age 65, does a grace period apply to the spouse? No. So when an employee leaves an employment, that spouse who's over age 65 will have 8 months from the time the employee leaves employment to get enrolled in Medicare without penalty or deadline. However, when that employee leaves employment, that spouse likely isn't going to have coverage or is going to have maybe COBRA coverage, which could be secondary to Medicare. So they may need Medicare for coverage reasons, but they will have 8 months technically to enroll without being locked out on their deadline. So there's not really a grace period, but at the same time, it doesn't have to be immediate. We typically recommend that if you're thinking about retiring, get in touch with us a few months beforehand so we can plan that out and make sure that your Medicare is in place for a seamless transition. If you were to get laid off, you could get Medicare as early as the first of the month after your application. So as long as we apply by September 30th, we can reserve an October 1st start date for Medicare. So it can be, it's going to be backdated once it's processed. It's not going to be processed by 10/1, but we can get somebody a quick Medicare effective date as early as the first of the following month if the employment termination was abrupt. What if an employer doesn't exist any longer? Well, that's a great question. I assume that question probably came through when we were talking about that employment verification form as the form that you need to apply for Part B benefits if you're over age 65. And we actually run into this situation more frequently than I would like because it is a big pain in the butt. We had a person who she had worked for the same employer. She was 85 years old when she retired. She had worked for the same employer the whole time, but the employer changed hands a couple times. It was a bank, and it had changed hands like 5 times from the time she was 65 to the time she was 85. So when she left the employment, she asked for that employment verification form, and they only provided it to her based on the most current ownership. And so she had 10 years of time from age 65 to 75 that she could not get an employment verification form for because that employer no longer existed and they could not give any way for her to contact somebody to get that form signed. And that created a huge problem because when she enrolled in Medicare, they said, we can't verify you've had credible coverage for 10 years, which means if the penalty is 10% for each year you go without credible coverage, she had a 100% penalty on her Medicare Part B premium. Now, of course, we appealed that, and through probably an 8-month research process, it was ridiculous, where we finally dug up old insurance ID cards, called the insurance carrier, got them to verify her coverage through that old employer. It literally took us 8 months to get to the bottom of it. She ended up getting that penalty waived. But what we normally recommend is if somebody can get advice as they're leading into 65, the first thing we always tell them is if you leave this employment, even if you're getting another job and you don't need to go on Medicare yet, get the employment verification form when you leave employment and put it in a safe place in your filing cabinet. So that way, when you eventually do retire later, you can just pull all those forms out of your filing cabinet and you only have to get the one from the most recent employer. Now, for you as an employer, what I would recommend is if somebody leaves employment after age 65 from your company, regardless of where they're going, by default, just give them their form. Because tell them, say, put this away in a safe place, because when you go to enroll in Medicare eventually, they're going to need to justify this time. So here's the form showing that the time you were covered with us, so you can justify that. So from an employer perspective, I would recommend that you give every employee as part of their exit package, if they're over age 65, that employment verification form reflecting the time they spent at your company and covered by your company. Okay, so there's a specific question about HSA and somebody's upcoming retirement on December 31st. That's probably one that I would prefer to answer individually. And I think there's a couple questions related to that. So that individual who's retiring on December 31st of this year, I'll review your questions and get back to you individually. When looking at the number of employees, is it based on the individual EIN? What if there are multiple subsidiaries? This is kind of a gray area. Typically, it's going to depend on the plan documents and how everything's put together. Most of the time we find that they take into consideration the multiple subsidiaries, but I probably would want to look at your plan individually to see how it's set up. If all the subsidiaries are on the same group health insurance, that's a pretty easy one. But if they're on individual separate group health insurance plans, that may be a little bit more difficult if some of those individual plans have less than 20 employees in each subsidiary. So that would be another one that I think we should maybe, if that was you asking that question, I'll pop you a quick email to see if you want to discuss that individually. Let's see if I can find any more generic. We have an employee spouse that is on Medicare Part A and B due to disability. The spouse is also enrolled with the company's medical plan. To be clear, is it the company's medical plan that is primary or Medicare? So when it comes to under 65 and disabled, the guidelines are a little bit different. So the break even is 100 employees there. So if your company has less than 100 employees, then Medicare is the primary payer for claims. And that person who's on Social Security disability is required to take Medicare A and B as primary insurance to your group health plan. But if your company has more than 100 employees, your company plan is required to pay primary, and that person is not required. They have to take Part A because Part A and Social Security income go hand in hand with each other. If you have Social Security income, you have to have Part A. But they are not required to take Part B because your company has more than 100 employees and would remain the primary payer on their medical insurance until something changed with that. So break even there is 100 employees for somebody on Social Security disability income. If I'm 64, just quit my job and took COBRA, are there issues with getting Medicare? No. When you enroll in Medicare at age 65, you may lose your COBRA benefits, but probably you're going to find Medicare to be more cost effective and better benefits for you than the COBRA if you go with, assuming you go with like a Medicare supplement plan. So what I would recommend is let's look at the cost of Medicare as it compares to COBRA, as well as your prescription costs, because that really would be the deciding factor there. But there will be no issues getting Medicare at age 65. Since you're not yet 65, you're not Medicare eligible, so you don't have to show any credible coverage. And COBRA will remain primary until you turn 65 and become Medicare eligible. How is Part B cost calculated if I work right up to obtaining Medicare? So that question may have come in before I went over the Part B cost. Part B is calculated based on your income from 2 years ago. So if you enroll in 2020, they would look at your income from 2018, determining your Medicare premium. But in January of 2021, they are going to look at your 2019 income. And in 2022, they're going to look at your 2020 income. So it's kind of a rolling Medicare premium based on the income from 2 years prior. So what I'll tell you is if your income goes down when you retire, that's a reason to talk, because there's an appeal form that you could submit. It's called a life event form. Your life event is retirement, and it says my income has gone down due to retirement. Here is what my income is planning to be for this year, and they can make a manual adjustment to your Medicare premium by bringing it to their attention. You don't have to sit and wait the 2 years. All right. What if you have an HSA but are no longer making contributions to the plan? That's fine. You can have the high deductible health insurance plan. You can have an HSA account with funds sitting in it, and you can continue to use those funds or save those funds for retirement. You simply cannot make contributions into an HSA account once you are enrolled in Medicare Part A, or Part B for that matter, but Part A is the free one that everybody enrolls in. If an employee enrolled in Medicare Part A at age 65 continues to work with a group plan without an HSA, but the employer elects a plan with an HSA at a later year, how does that impact the employee? So the employee if the HSA was the only option in a later year, the employee can go into that high deductible health plan. Now, there can't be any contributions made into the health savings account, either by the employer or the employee for that matter, because they already have the Part A and they cannot disenroll from Part A once they enroll in it. They give you a couple-month window to say, oops, I made a mistake, I want to withdraw my application. But once you're enrolled in it, you can't disenroll in Part A. You can disenroll in the Part B, the part you paid for, but you can't disenroll from Part A. So for that employee, I would say no contributions to the HSA. I've seen some employers set up an HRA for those such employees that are over 65 because HRA is fine, but HSA is not okay after age 65, no deposits. If the employer or employees, is it the employer or employee's responsibility to keep track of whether or not someone has an HSA and Medicare? Technically speaking, it's the employee's responsibility to keep track of that. As an employer, I would probably recommend, just so you know that you have brought it to their attention, because they may not know. It's probably very unlikely that they would know if you didn't tell them or you hadn't brought in any Medicare education. So most people do not know this. So I would recommend during your annual renewal, when people are signing up for their plan, maybe having just a little disclaimer that they check the box or they initial next to saying, I understand that if I am 65 years or older and I'm enrolling in the HSA plan, I cannot make deposits into my HSA account if I'm enrolled in Medicare. And so that way, by initialing that, you know as the employer that you've brought it to their attention. Now, whatever they do after that is on them. It's their responsibility. But for you, as being full disclosure from the employer, you may want to just have that little caveat in your HSA enrollment kit, just a little disclaimer that they initial or sign, saying that they're aware that they can't have Medicare and deposit in their HSA account. Although it's not required of you, I would recommend it. What if your RX costs are very high? Okay, if your RX costs are very high, they're likely to be very expensive in Medicare as well. Medicare prescription drug plans are not great. They have certain features in them. Maybe you've heard the term deductible. I'm sorry, not deductible. They do have deductibles. Donut hole or coverage gap, where your costs can fluctuate throughout the year. Typically, I'll tell somebody if you have inexpensive generic prescriptions, your script cost is going to be super low in Medicare. You're probably going to have $0, $3 premiums, $10 premiums, very inexpensive. But if you have very high prescription costs, they're likely to be very high in Medicare. If they get too high, if your total prescription costs exceed $6,300 per year, there's no maximum out of pocket on prescription plans, but after $6,350, you go to the catastrophic level and you only pay a 5% copay moving forward for the balance of the calendar year. Somebody who has over, let's say, I don't know, $10,000 a month in retail prescription costs, so maybe $100,000, $150,000 in prescription costs each year, can expect somewhere in the ballpark of about $8,000 to $10,000 out of pocket in prescriptions in Medicare. Now, if somebody has, more nominal prescription costs, prescriptions don't have to be expensive, but, some of those drugs come out and they're retailing at $10,000 a month. So if somebody's on a drug that retails at $10,000 a month, their average annual out-of-pocket prescription expense is probably going to be somewhere in the $8,000 ballpark. Now, there's low-income programs and stuff like that you might be able to get help with. There's certain ways that, like if you're getting an injectable like a Humira for rheumatoid arthritis and you're injecting yourself at home, if you go to the doctor's office to get that injection, it's covered under major medical and it's virtually free. So there's different things we can do to talk about specific prescriptions. But yeah, prescription drug cost is one of the bigger out-of-pocket risks in Medicare. If you have supplement, major medical-wise, you're going to be golden. But the prescription costs can be a bit troublesome sometimes. Can you do a cost analysis example for someone under age 65? I found with what I saw, when you include Part D, the cost is very expensive out of pocket. It really is going to depend on what someone's prescription drug expenses are. We typically don't do cost analysis for someone under 65 unless we're doing it for the purpose of saying when you turn 65, here's what your Medicare expenses would be. Unless the question is pertaining to somebody who's under 65 and on Social Security disability and therefore qualified for Medicare, absolutely we can do that cost analysis. But yeah, we look at the major medical expenses, the premium, and from there we can come up with a high level. Does Medicare look attractive or not? And if Medicare looks attractive, the next thing that we do is we dive deeper into the drugs to see if the drugs make that decision any different. So I don't know if I answered your question there, but yes, we can do a cost analysis, and if someone's on expensive prescriptions, that may be one reason to keep their group health plan. All right, I think we still have, before we get cut off here, Heather, we still have another couple minutes. Do you want me to keep going through questions? We still have a whole slew of them in here.
Hi, Tracy. Yes, we have a few more minutes, so I'll let you know.
Okay, all right, I'm just going to keep reading them off until we run out of time. Okay, what about an employee who is a high earner? I believe they have to pay a higher cost. Is that right? So yes, and I think that probably was answered later in the presentation, where if they're at a higher cost, they will pay a higher Medicare premium. And it doesn't matter who the breadwinner is of the household. If only one person is a wage earner in the household and they fall into the $750,000 plus category, their stay-at-home spouse that earns nothing will be in that same category because they filed their tax return as a joint household tax return. So each spouse pays the same premium. I thought you need a life and vet to enroll, but could unenroll at any time. I'm not sure if they mean enroll, if this question means enroll in Medicare or if it means enroll and unenroll in your group health plan. So what I said in the cost analysis was there's a couple times a year you can get out of your group health plan. Some group health plans you can get out whenever you want, but I believe if your group health plan is part of a Section 125, that you can only get out of it for certain life events. Perhaps some plans are different than that, but we do find enrollment in Medicare considered to be a life event in about 95% of plans. So really, anytime somebody wants to enroll in Medicare, we can get them out of their group health plan with most insurers and most employers. Is IRMA calculated each year or is it frozen? So that, again, that's each year. So they're always looking 2 years back. So in 2020, they're looking at 2018, 2021 is based on 2019 income, 2022 is based on 2020 income. And you have the right to file an appeal on that if you want them to do a manual review sooner. Somebody's interested in more information, thank you. We'll get in touch with you. Would like to explore doing virtual sessions for employees. Thank you. We will definitely get in touch with you. How do I get a copy of the appeal form for the monthly costs? I will send you the appeal form. Is Part A automatic enrollment? Only if you're collecting Social Security income prior to your 65th birthday. If you are not collecting Social Security income prior to your 65th birthday, it is not automatic. Whenever you enroll in Social Security after age 65, they will enroll you in Part A and they will give you the option to enroll in Part B at that time. So Part A is only automatic when you have Social Security income. Can you enroll in Medicare Part A at any time after turning 65? If not, yes, you can enroll in Medicare Part A anytime after 65 as long as you qualify for free Part A, which means either you or your spouse has paid Medicare taxes, which most people have. If you haven't paid Medicare taxes, there are certain open enrollment times, and you could be subject to a penalty for enrolling late, but that pertains to very, very few individuals. Can a person opt into Medicare to save the money but still remain in the company dental? Yes. Okay. So if somebody is still working and is eligible for group benefits but wants to enroll in Medicare because they feel that that's better for them, they can enroll in Medicare. And as long as the dental plan is separate at the employer level, it's not part of the health insurance plan, most of the times people can opt out of the major medical on their group plan, but remain in the dental insurance on their group. So yes, that can absolutely be done. Thank you for the presentation. You are welcome. Let me just go back through. Has there been any discussion in Congress about making change to push back the eligibility date to coincide with Social Security or normal retirement date? I know there's been a lot of discussion to bring the eligibility down to 50. I have not heard of anything about changing the eligibility date from age 65 to normal retirement age. It hasn't been anything that's come across my radar. I do pay attention to the certain Medicare circles, so I'm fairly confident that that's not been discussed yet, but I couldn't tell you for certain. It's something that's definitely not being discussed by the insurance companies or anything at this point, though. What about domestic partners? So domestic partners, that is an interesting one. I can tell you on most levels, domestic partners are considered a spouse, but there could be some additional rules around the Medicare Part B. If you have a domestic partner that is not actively employed, that is a dependent on your group health insurance plan, I'm not 100% certain about their ability to waive their Part B, so I'm going to look into that and get back to you individually on that. Sorry, I don't know that answer off the top of my head. When looking, I think I may have, bear with me one second, I'm just flipping through these. I have retirees on our group plan, which we moved to ACA when we fell below 50 employees. Before, we had a fully insured plan that had more than 50 employees. If they didn't have Part B before we moved to the exchange and need to go for Part B now, is there a penalty? So when you were on the fully insured plan, that's not an issue. When you move to the ACA plan, and perhaps I might want to get a little bit more understanding from you on this plan. I might email you, because when you say ACA plan, do you mean actually individual ACA products, or do you just mean a non-fully insured group plan? Because the two qualifying factors are active employment and group health insurance. So I think I'm going to reach out to you individually to get a little bit more detail on what you mean exactly by that ACA plan, because I don't want to give you a wrong answer. How would I explore doing virtual sessions? I will send you an email. Thank you for providing your email address on how to set some of those up. I will tell you that if anybody's interested in doing virtual sessions for their employees, we do not do company-specific individual sessions. So during most of the year, if you called me and said, Tracy, I want to do a webinar specifically for my employees, we would come on live, speak directly to ABC company employees, and we can go into specifics about your group health plan versus Medicare if you want us to. But during the fourth quarter, the annual enrollment time for Medicare, everybody on my team is so busy helping all of our existing clients reshop their Medicare prescription program, and all of the new retirees that are planning on retiring on December 31st, that we actually have all hands on deck working, helping individuals with their Medicare needs, that we don't have time to do company-specific presentations. But what we do offer is we have about 6 presentations, employee presentations, scheduled through the end of the year, very similar to this format that you're in now, where people log in, they listen through their computer speakers, we go over all of the education with them. When they register, they say who their employer is, so that way we can send the employer back a list of the employees that registered for the event, so they know who attended the event. but we wouldn't speak specifically to your group benefits. It would be completely confidential and privacy protected. Nobody else would be able to see your employee list except for us, the people doing the webinar, and we would send you a list of that. So it's our way of being able to get this education out in an effective manner during our busy season while still giving 100% of our focus and attention to all of our clients that need to address their specific Medicare matters. So we do have a lot of sessions already pre-scheduled for October and November, and I would be happy to send those links to you. And starting in January 2021, if you wanted to set up a company specific for your company and speak specifically to that, we could do that. Okay, I think I went through all the questions except for the ones that were a bit more specific, so I apologize if I did not answer your question. I will be addressing that via email after the presentation, and I can provide a phone number if you wanted to call in and speak with somebody one-on-one, but I just felt that they were a little too specific to be answering in this group environment here. So again, I wanted to thank you. It sounds like we had a good session. We had a lot of really great questions, so I hope you all got some good information out of this and learned a little bit more about Medicare today. So thank you again for your time.